Hey everyone, I have on Kristin Brown and I am so excited to chat with her. I got to meet her a couple months ago in California. I know I've had a few guests that I got to meet, so you guys have heard me talk about this amazing retreat and the amazing women that I met on there. And Kristin was one of them. And she is a prenatal dietitian and she shares so much information about optimizing your nutrition, growing a healthy baby, and things that you can do before you get pregnant, during pregnancy, to help create better birthing outcomes, and even some information on sperm health, which you guys know that I love to talk about because I feel like the burden just always falls on the woman. And the guys are like, whatever, I'll just drink a 6-pack of beer and that's my contribution. And you're like, mm-mm-mm. So I'm so excited that she's here to chat with us today. So thank you so much for coming on the podcast.
Yay, thank you so much for having me. I'm so excited.
Me too. So before we dive in, I always love to talk about your story. What brought you here? What made you want to be a prenatal dietitian? And how you got into this line of work.
Yeah, so for those of you who don't know, I have 6-year-old twin girls. So along with having twins, I had probably the highest number of practitioners on my case. So my pregnancy had a lot of ups and downs, and I was transferred to different hospitals based on like where baby ventilators were available. So I had a lot of maternal fetal medicine doctors. I had tons of OBs. I had tons of nurses, all with eyes on my case. And I do this thing where I don't tell people what I do for a living, like especially when it comes to like my own health, because I never want people to assume that I know things that maybe I don't. So they didn't know that I was a dietitian. It never once came up, and no one ever spoke to me about nutrition once. So I had a lot of knowledge and I knew what to do. And I was like, you know, putting my supplements together and like focusing on different foods and that whole thing. But nobody knew that. So there was one question at one point, asking me if I was taking a prenatal vitamin. And, I was having two babies. Like I was growing two babies, two placentas, like, and it was just never a question. So I was like, if that's what I'm getting, which is a high risk pregnancy, that it has a ton of nutritional demands, like what is everyone else getting?
Mm-hmm.
Right? Are they getting anything? I got one sheet that had like some food safety stuff on it, and that was it. So to me, and the more I dug into it after that, seeing, how much control we had on the health of future generations based on what we put into our bodies during pregnancy, I was like, what are we doing? Like,
Yeah.
we have this opportunity and we're missing it. So my goal at that point became, you know what? I'm just going to get information into as many people's minds as possible. So there's only so many people that I can work with one-on-one, but I was like, you know what? If they, find me on social media, then they can access some of this information that they are probably not getting anywhere else. So that is sort of how things came to be. And I just continued to share. And, fortunately, people were interested in what I had to say. So it's a
Yeah.
long journey, but definitely an important one for sure.
Yeah. I mean, you bring up just so many good points in there. Like at your prenatal, your first checkup, right? It's like, here's some foods not to eat
Mm-hmm.
and take a prenatal.
Yeah.
That's
Yeah.
basically all the information that we're given. And I've been recently like learning so much more that I had no idea about. And I'm like, holy crap, like there is this huge gap in care. And the only way that people are finding this information out is going through some sort of specialty field or finding somebody outside of their provider to give them this information, because it's not just widely shared with us. And as you said, you can change, we can like start to change the health of future generations, which I think is also another thing that's like not talked about at all. And I think that our generation is feeling that because of the health of our parents and decisions that they made, just because they didn't know any better. There wasn't,
Yeah.
I mean, the health industry is blown up and they weren't looking at every ingredients and everything that they were eating, that they were exposing themselves to, that we grew up on. And you see that impacting fertility now, you see that impacting health outcomes now in tons of different ways. And so changing that does start with us and with learning what we can do. And I think that it can feel daunting, because then like hearing this, you're like, so I can never eat ice cream again, or like, what are you saying?
Yes, totally. And do you know what the lens, I guess like two things I really like to focus on, especially when I share information with people, is like, I want it to be super simplified and like really actionable. Like, I don't want to like bog people down with the mumbo jumbo. I want to be like, let's just focus on doing like X, Y, and Z really simple. And if we can integrate it in a way that's sustainable for you, then that's going to be beneficial for you. It's going to be beneficial for baby. I don't want to get like caught up in the nitty gritty. I want to like pick the heavy hitters and like really focus on those.
Mm-hmm. Can you maybe give us a couple of examples?
Oh, I love that. Okay. So, a couple of things that I see all of the time people missing, and all of the time people missing if all they've done is take a prenatal vitamin, which is great. Like, I never want people to listen to this and feel like I did a disservice to my baby, because we can only do what we can do with the information that we have. So if you're learning something new as you listen to this and you apply it to your pregnancy now, that's amazing. If you already had a baby and you didn't know this stuff before, then that's okay, because we can't be expected to know all of these things when we haven't been given the tools that we need, in order to apply these things to our life. So if you're just taking a prenatal vitamin, then chances are, depending on what you're taking, I would check vitamin D levels, because chances are those are probably low. Most prenatal vitamins don't have omega-3 fats in them for good reason. When we put omega-3 fats in with other vitamins and minerals, it's not very stable. So it's not a really good combination to put them in there together. So if you're not supplementing with omega-3 fats otherwise, then, or eating enough fat equal water fish, then chances are you're probably not getting enough. So there's two things. If I'm to add like one more that gets missed all of the time, is choline. So choline is quite a bulky nutrient when we put it in supplemental form. So a lot of, companies don't want to make their prenatal like a million capsules a day. They want it to be one a day. So they're not going to put choline in there because it takes up too much space. So
Yeah.
it's automatically going to make it more capsules per day, which to them from a, consumer perspective is less desirable, because people think, if I can get everything from one and you're telling me my other option is to take 8, like I'm just going to take one, right? But they're not really educated on the difference. So those would be 3 of the nutrients that I see. If we could just start there with those 3, it would make a meaningful difference for everyone.
For moms, for babies.
Yeah.
Yeah. That's super interesting. I feel like, so I interviewed somebody like a couple years ago. I had on Dr. Rhonda Patrick, and she talked about like fish oils and like even through breastfeeding, and like how some of the research, like taking it in pregnancy and breastfeeding and things like that, how it had like these amazing outcomes. And ever since I interviewed her, I've taken like like it more. But honestly, it's really weird, because like if you ask my husband, he'll say that I'm like a supplement queen, which isn't always a great thing. Like I'm sure I blindly have taken things before that I didn't need or that weren't doing things for me. But the only supplement that I've ever taken that I have felt a difference was omegas. And I take them in the morning, and I feel like it actually like helps me throughout the day, like have a little bit more energy or a little more concentration or focus. I'm not sure what it is, but that's the one supplement that I've taken that I've actually seen a difference, like in how I feel, whether I take it or not. I don't take it on days that I eat fish. Just cause.
Yeah, no, that's fine. That's totally
But
fine.
yeah, it's weird. It's like the only one I've ever like felt something from.
That's so cool. I do hear that a lot actually when I have clients who are struggling with like inflammatory issues, that
Mm,
omega-3 fats can make a massive difference for reducing inflammation. So
yeah.
I do tend to find that people can notice quite a significant difference from omegas.
Yeah, I know for sure I have some inflammation issues, so that's probably it. Um, so what are, I guess, like for people listening, let's say they're going to be trying to conceive soon.
Mhm.
Again, there's a huge gap in care there. It's like just get off birth control and you're good to go. Versus like, let's make sure that you have everything you need to create a healthy, viable pregnancy. Because if you're going into your first trimester depleted, you're going to continue to be depleted. And there's even some stuff kind of showing that that can be linked to morning sickness and other things when you don't have these nutrient stores built up. I also feel like you hear the cases though, too, just for people listening, like there's always the people that do everything right and they're still throwing up every day, you know? So don't feel like I'm being like, well, you didn't do things right. Um,
Yes.
because there's so many things that go into morning sickness. Like they don't even totally understand everything with it. So, if somebody's listening and they're going to be trying to conceive, are there certain nutrients that they could focus on that could optimize egg health or sperm health or conception?
Yeah. Yes. Okay. So, what we do know about egg quality is that is very much affected by our environment. So, whether that's the foods we put into our body, oxidative stress that we, come into contact with in our environment, all of those things can impact the quality of our eggs. And if we look at what causes miscarriage, a lot of times it's chromosomal abnormalities, right? So there's a lot of things when it comes to miscarriage that we cannot control, but some piece that we do have a little bit of control over is the health of our eggs and sperm. So, what we're doing today is going to impact the health of our eggs about 3 months from now. And what our partner is doing now will impact the quality of his sperm 2 months from now. Now, with the male partner, it's a little bit easier because it's easy to do a sperm analysis and see the changes, which is really,
Mm,
really cool. So sometimes I'll work with couples and we'll do a sperm analysis at the beginning. We'll do another one in a few months, and the difference can be like absolutely mind blowing just from diet and lifestyle changes. Okay. So when it comes to sperm quality, usually what I'll recommend, and it's a little bit different from case to case, there's some lifestyle things that I'll recommend. So, if I have a client who likes to cycle and wears like really tight shorts, or likes to go in the hot tub or the sauna, or uses their laptop and puts it directly onto their lap when they're working, like anything that's going to be like tight and hot in that area is not going to be good for sperm quality. From a nutrition perspective, the omega-3 fats, again, become
yeah.
really, really important. Any antioxidants. So that could be from like leafy green vegetables or berries or nuts. Like there's quite a bit of research on even just having like an ounce or two of nuts every day for a snack can impact sperm quality. Folate, which is like a superstar for, early pregnancy, is also really good for sperm quality. So that becomes a big one. I always like to check vitamin D levels as well. And then if there are some significant issues with sperm quality, then we'll get into like a little bit more targeted supplementation. So whether that's using coenzyme Q10 or some, you know, more heavy hitters in terms of like potent antioxidants, we can kind of add those things in there. But for a baseline, including some of those foods can be really helpful, especially if maybe you don't feel like getting a sperm analysis is going to be part of your journey. Then just sort of incorporating those foods on a regular basis for the male partner can be really beneficial.
Hmm.
And then for women, unfortunately, we can't just sort of like extract an egg and look at the quality. It's not quite as simple as it is
Yeah.
for men, which is unfortunate. But I have had a number of couples who I've worked with who have done an egg retrieval and then ended up finding me. We ended up working together and they ended up with, you know, really no viable embryos. to making these changes to their diet and lifestyle and ending up with a number of good quality embryos. So, whether or not these instances are, by chance or because of all of these changes and the work that they put into, change their nutrition and change their environment, we'll never really know. But it's really the only way that we can tell that potentially there is changes happening to egg quality. So a lot of the same things are important for eggs. So they're very, very susceptible to oxidative damage. So we really want to focus on anything that is going to, increase our antioxidant consumption. So that again could be dark leafy greens, berries, grapes, bell peppers, carrots, anything with, a really rich color is going to be like wonderful to include. I like to always check vitamin D levels. Okay. There is some evidence that, unexplained infertility or difficulty conceiving could potentially be linked to low vitamin D. Most people have low vitamin D, especially if they're not supplementing.
Yeah.
So that is just a very low hanging fruit for me. Like, let's just check it and see what it is. Another one is, poor thyroid function, which a lot of women deal with. So I'll usually get them to check their TSH levels and kind of dig a little bit deeper if that number is looking a little bit wonky, just to make sure. So that is definitely a big one too. Again, coenzyme Q10, which is great for, the male partner, is also really, really helpful for egg quality. And now we have all of these like really potent, antioxidant rich supplements that are like a beautiful blend of nutrients that are really good for egg quality in quantities that have been shown to be beneficial. So like Need It has a wonderful egg quality support supplement, a sperm quality support supplement. So some of these companies that are a little bit more cutting edge in their research are coming up with products so that we don't have to piecemeal it together the way that I did when my kids were little. So it is probably the easiest time, since I became a dietitian over a decade ago, that, these companies are actually putting together products that are really helpful, with nutrients and in quantities that are therapeutic for us. So those are some of the foods that I like to include. And then depending on kind of where you're at in your journey, maybe you decide to include some of these other sort of, supplemental forms of nutrients, or maybe you don't. So really it just depends on where people are at and sort of what their concerns are.
Mm-hmm. Yeah. I mean, I feel like most people probably just aren't that concerned because we're
You're
not,
probably
again,
right.
like told anything about it. So it's not like, hey, you should work on egg quality health before having a baby. It's usually after people are trying and trying and trying that they're like, okay, something's not right. Unfortunately, again, there's just gaps in care all over the place. So it's not like, oh, you're planning on trying to conceive soon. Here's some nutritional information. Here's some other things to look at. So I think that's why I love having these conversations too, because, like I've never been on, like I went to an OB/GYN before I got married, and I'm like, I know we're going to want to try to start having kids in the next year. And he's like, great.
Bye.
Like, right.
Have fun.
Right. There was no, oh, great. Like, here's just some information when you guys are getting closer to the time to look at, or here's some resources. There's nothing. So I feel like and then you don't get tested until your first trimester. What all do they pull? I don't remember. I know that they do like the STD stuff. And then I know they look at iron, vitamin D, thyroid.
And thyroid and iron for sure. Vitamin D, if you're lucky, like sometimes
Okay.
it's like pulling teeth to get a vitamin D check. So I
Yeah.
really like, you really do have to advocate for yourself, because sort of the baseline care, unfortunately, is just not awesome. So I do tend to find that my clients that work with midwives tend to have a little bit more comprehensive care. Their, initial appointments are so pregnancy focused versus
Yeah.
ones who kind of go with their standard, primary care doc, eventually onto an OB, that it's really just sort of like monitoring for issues versus like optimizing health.
Right.
So it is sort of a little bit of a different lens. I know sometimes people are like, kind of, they think midwifery means like you have your baby in a field, like while people sing kumbaya and like whatever, but it's not like that. So I
Right.
really wish that we could do like more debunking around what midwifery care is like, because I do tend to find that prenatal care is quite a bit more comprehensive when people do go down that road.
Yeah. Well, I mean, I just had my appointment today, and I know that they checked my vitamin levels first trimester and third. Um, and one thing that I just like find so different is like my appointment was like 45 minutes, like and I had a new midwife today that I hadn't met yet because there's 4 in the practice. Um, and I'm going to the same place I birthed my last daughter, and they've added on because they've grown a lot. So, and she was just like, I haven't met you before. Like, tell me about yourself. How are your last births? Like, what's going on this birth, like this pregnancy? What are you nervous about? Like, she was just asking me so many questions and just, diving into tons of stuff. And then I was telling you before we got on, I was like telling her about my weight. I'm like, I just feel so huge. Like, I'm, I, I'm uncomfortable already and I still have a couple of months. And she's like, okay, well, if you want to do a weight check today, we can. If not, we don't have to. And then I even asked her about, I'm like, so when do I start peeing at the appointments? Because we've always like peed when we go in and they check your urine. She goes, we actually don't do that anymore. It's not evidence-based. It's not a great way to screen for preeclampsia. We look at other risk factors. And then if those come up, then we'll check your urine for protein. I was like, oh, okay. Like I've never had this happen before. But it's like, it is just like such a different level of care. Like they know my husband, like the other midwives there, which like they got to know him. So even like during the birth, I felt like they knew how to like be there for him as well, as me. And yeah, I just can't picture like being in and out of a place and not like, sometimes appointments, I'm like, yeah, nothing's going on. There's nothing new, whatever, but a while ago I was having like some fears and different things. And the midwife was like, do you want me to check on this for you? Like what, like just, so I feel heard
Yeah.
at each
Yeah.
appointment. And I also know not all midwives are equal as well. So I know people who haven't had amazing experiences. And also depending on where you're going, like certain laws dictate how they can practice too, and insurance and different things like that. So there's a lot that goes into it, but I definitely agree with what you're saying. Cause even I went to my midwife before I got pregnant and I was like, I just want to pull some levels. And she ordered the blood work for me, like, cause I don't have a doctor.
Right. Yeah. 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 No, I know. And definitely, I've had other clients too who have had wonderful experiences with their OBs. I know some OBs who are absolutely phenomenal,
Oh
who
yeah.
talk about nutrition or who recognize that they don't really know a lot about nutrition and they'll send a referral. So there are wonderful practitioners, who wear all sorts of different hats. So I definitely don't want this to be like, bashing, primary care doctors or OBs, because they're wonderful providers there as well. I think it's just a matter of knowing where to go for the information that you're looking for. So, like, you
Mhm.
wouldn't go to your primary care doctor to assess your pelvic floor, right? You would
Right.
go to a pelvic floor physiotherapist. But for some reason with nutrition, we just assume that our doctor knows everything about nutrition when really they've received almost zero training. They know, you know, about nutrition just as much as, I don't know, someone who's going to fix your refrigerator, maybe a little bit more, right? Like
Right.
it's really very minimal, but we put all of this trust in them. And I think it's just a societal thing where we expect them to know everything and nobody can know everything. So it's just a matter of kind of having some sort of comprehensive team that can work together to really support women in a time when they're feeling nervous and
Right.
they're feeling information overload. And, it's also a really critical time for their health and the health of their baby. So if we just all worked together in a little bit of a different way, I think we could really start to serve this community in a way that allows everyone to be healthier.
Right. I mean, how I view it should go is like you're pregnant and you call your doctor's office. A lot of times they can't get you in until like 8 to 12 weeks. That they refer you, okay, like before you come in or sometime in the first trimester, we're going to refer you to a dietitian where you can sit and go over nutritional information. And then at some point in pregnancy, you're also referred to pelvic floor therapy, or at least for sure afterwards. Like you said, like just kind of like this collaboration, because there's just so many gaps and we're left to figure it all out on our own. And it wasn't until like just a couple months ago, I learned that your need for vitamin A increases threefold in your third trimester. No idea. No one's ever said that to me at any of my appointments. They're not like, here's a list of foods that are vitamin A rich because you need this for oxytocin receptors in your body for labor. Like nobody's ever said this before. I learned it interviewing somebody on my podcast. So it's like, what? Like how? Why? Like why? I went through, this is my third pregnancy and I'm just learning about it. So that's, where it is a struggle to get that information. And there are so many things that do impact birthing outcomes. So if you have a talk around nutrition in your first trimester and you learn some things, you can decrease your risks of preeclampsia, gestational diabetes, other things later on. But we're not given that information until it's like, hey, you have gestational diabetes now.
Yes. And I get a lot of those emails where it was like, I was just diagnosed and like, I am terrified and I don't know what to do. So, which are some of my favorite people. But if we had that information before, or if we had a previous pregnancy with preeclampsia, like we know that calcium supplementation can be really effective at decreasing risk of, being diagnosed with preeclampsia again. So there are all of these other little things that we can do to help improve pregnancy outcomes. We were talking before, we hit record on preterm birth. And we know that omega-3s can be so helpful at reducing risk of going into preterm labor. But we just miss it. We just don't put really any emphasis on it, which is very unfortunate. So I do think nutrition, when it comes to preterm labor, when it comes to even like postpartum depression, which is obviously, there's so many pieces at play with that, but there is a nutritional component when it comes to preeclampsia, when it comes to gestational diabetes, right? Nutrition plays a huge role and we just don't give it the attention it deserves, unfortunately.
Right. What is like, I guess, because most people, like we're told, just take this prenatal. How much are we actually like getting from our prenatals? I know not all of them are created equally, and that a lot of them go off of the minimum RDA. So the minimum recommended daily, what's the A mean?
Allowance.
Yep. Okay.
Yeah.
So it's like, okay, so you're getting your minimum amount of vitamin A in your vitamin, and assuming you're getting the rest from your food. So like, can we just take a prenatal and be like, okay, we're probably getting everything we need. We're fine.
So I love that question. And especially with vitamin A, because vitamin A, especially in supplemental form, like we have two different options. So we can supplement with active vitamin A, which again, people have been so fearful of, because when we think about vitamin A, especially in pregnancy, we're like, oh, well, I can't use, any sort of like medication with vitamin A. So any sort of like, Accutane or like a retinol on your skin because it's teratogenic. But what we forget is we do need some of that active vitamin A. So we like take these fears and we blow them up to a point where like women are only supplementing with beta carotene, which is, the inactive form of vitamin A, which we need both. So even just that in and of itself. But when it comes to prenatal vitamins, you're absolutely right. Like there's such a huge variety in terms of what a prenatal will provide. They are better than they have ever been, which is wonderful. And I think a lot of that is sort of, people in this field really pushing forward and like wanting women to be able to access better quality products, because for a long time they were like a one a day with least bioavailable forms of nutrients, like hardly any, you know, amount of anything to write home about. Or I have some people who come to me and they're like, my provider told me all I need is folic acid, so I just took a folic acid. Or my favorite one, you know, I heard from my doctor that, vitamins just create expensive pee.
Mm.
Which I'm like, yeah, like perhaps like if you are taking a vitamin that has the least bioavailable forms of nutrients in quantities that, aren't really going to do anything, then yeah, perhaps. But in other cases, it can really change the game. So a couple of things that I look for when it comes to prenatals is I never recommend a one a day.
Right.
So if we look at how we're going to get the best bang for our buck from our vitamin, what we want to do is we want to break it up in divided doses, because our body's going to be able to absorb more that way. So if we could break it up into 2, wonderful. If we could break it up into 3, great. If we could break it up into 4, fantastic. So it's not always possible for people to do that. And I get it. Like, depending on sort of what your budget is for a vitamin, it's going to, dictate what you're able to take. And I would prefer to see people spend money on food, especially now where food is more expensive, like arguably than it's ever been, that I do like a food first approach when it comes to pregnancy, especially if you're carrying multiples. It is a good time to invest in some supplements if that is available to you. If not, I really recommend focusing on incorporating some of these nutrient dense foods. But a prenatal that you take multiple times a day is something that I will always, look towards. Some choline, whether it's in your vitamin or you supplement with it separately. It's a very inexpensive supplement, and we have quite a bit of data on the impacts for brain development, for placental health. So it is one of those nutrients that are key, and one that I will routinely see low when I do diet recalls. So that in and of itself can make a huge difference. Again, vitamin D becomes really, really important. I like both forms of vitamin A. I like a really, bioavailable form of magnesium, especially in the third trimester, as you get like more like aches and pains and muscle tightness and maybe some difficulty sleeping. It can be really helpful for that. So those are some of the nutrients that I look for. There are some brands that have really incredible marketing power behind them that are really not a great quality, and it kills me to see people spending money on something that I see as an inferior product. I don't know if I'm like, am I allowed to say, like, am I allowed to name drop? Like Ritual.
Yeah, that's the first one that came to my mind. Their marketing's so good, and
their marketing is phenomenal. Their product is terrible. And the price point is so high for what it is. And when people come to me and they're taking it, they are so proud. They're like, I'm taking this. Like, aren't you so excited? And I'm like, I hate this actually, in nicer words. Right. But I do think this is a great time because there's so many wonderful products. But I also think that we have these companies that have so much marketing power behind them and are essentially, sort of cheating women out of, their money, and maybe sort of tricking them into thinking that they are getting the best product that their money can buy. So it is a tricky time, but I think if you know what to look for, or maybe some of those key things to look for, that you can choose a product that fits your budget, but also, is going to give you the best bang for your buck.
Right. I know you're a fan of Needed, and I talk about that on here because I also love that they have different options. There's the 8 capsule a day, just the essentials, so it's less capsules, and then the powder form. So you can kind of like choose through there. And I know that they're a brand you recommend. Is the other one like Fullwell that's like okay, the other one that I've heard a lot of good things about is called Fullwell as well.
Yep, absolutely. So what I like about Needed is exactly what you said, how there's so many options. So maybe the 8 cap a day option is like very overwhelming,
Right.
or maybe the price point's way too high, that the essentials is still going to be, and I like will 100% stand by this, will be better than every single prenatal that you will find on the shelf at the health food store.
Right.
And that's their cheaper option.
Right.
So if you could spend, whatever it ends up being, 30 whatever dollars a month, um, you're going to get a really, really good product with just the essentials and not have to take the 8 caps a day if that feels like it's not really an option. But
Mhm.
Fullwell is another really, really good prenatal. So there are some on the market now that are so research based and, will fill those gaps. It's just a matter of finding, one that is going to work for you.
Right. Right. I know I had a friend super excited to get pregnant. And like she like picked up some like prenatal at Target and text me the back and she's like, is this good? I was like,
I
I'm
know.
like, well, it's a start.
Yeah, which is
Start.
good, right? Like a prenatal arguably is better than nothing, right? Because you
Yeah.
are going to get something from it. But if you're going to spend your hard-earned money, I want it to be on something that is actually going to move the needle.
Yeah, that will do something for you.
Yeah.
I have a question. So
Yeah.
I take Needed in mine for my pregnancy. Is it possible to get too much of a vitamin or a nutrient? Because I also take like magnesium before bed. Or, I don't know. I'm trying to think of any other. I don't outside. I mean, I take a lot of supplements. I take my prenatal. Um, I take probiotics and I take fish oils. And then I think just collagen and magnesium. That's probably it. But like if I'm taking magnesium and there's magnesium in my prenatal, am I getting too much?
There's always a possibility of getting too much of a nutrient. Sometimes I think we think about vitamins and we're like, it's just vitamins, but too much of a good thing is not good. So there's only 200 milligrams of magnesium in your Needed prenatal, which is good. It's way more than I would say any other prenatal on the market. And it's a very bioavailable form. However, if you're adding another 200 milligrams, maybe in the evening to help with sleep, you're still going to be in an okay range. If you're adding, 800 milligrams, then maybe it's something that we would want to scale back on. It just depends on how much additional magnesium you're adding. But I do love magnesium. So a lot of times too, I'll recommend in the 3rd trimester that my clients start using like a topical magnesium,
Mm-hmm.
especially if they're finding that they're getting restless legs. It can be like a really gentle way
Yeah.
to get a little bit more without having to add an additional supplement.
Mm-hmm. I forget about that because I have the Earthly brand, like magnesium rub. I forget that I have that. I could do that. Um, yeah, I don't know if I do it for rest. I feel like I start getting like leg cramps the heavier I get. It's like my legs will start to cramp up while I'm sleeping. Um, but I would love to talk about iron. So that's something that's like kind of controversial, like in a prenatal, whether you get it in a prenatal or not. And then I think most prenatals don't have it in there, to my understanding. I mean, some
Okay.
might. I'm not
So
sure.
most do.
Almost
So
do, but
most
they shouldn't.
do. They should not. So
Okay.
the reason why is because, I mean, for a number of different reasons, but one of the major reasons is because most prenatals will also have calcium in them.
Mm,
Okay. And calcium inhibits iron absorption. Okay. So it interferes with iron absorption. So we don't want calcium and iron in the same capsule together because then how much iron are we actually getting?
mm-hmm.
Right? Because we have something that is in there that is directly competing with iron for absorption.
Yeah.
So, what we would want to do is separate iron out because that is going to allow it to be the best absorbed. The other thing is that if you're struggling with nausea and vomiting in the 1st trimester, the first thing I'll do with my clients is take iron out of the picture
Right.
because iron can be a trigger. but I still want them to get everything else. So if it's tucked in their prenatal, it's not easy for me to take it away. It's not possible.
Hmm.
But if iron is separated out and they have their prenatal plus their iron, then we can just stop the iron for a little bit until they're feeling better, but keep everything else in play.
Yeah.
And not everybody ends up needing iron throughout.
Hmm.
So it ends up being something that, if it's in there with everything else, maybe we don't even really need it. So it's one of those things that I like to see it separated out because I like to have a little bit more control over the dosing. Some people need a lot more, some people don't need any. And I like to have that flexibility. I also want it to be absorbed well. So I don't want it to be mixed in there with
Yeah.
calcium. So I do like to see them as sort of, two separate supplements.
Yeah. Talk to me a little bit more about iron, because that was also like on your list of things that can prevent preterm labor. Was that it?
Well, it was things to look for, like things that I would want to see corrected before you get pregnant.
Oh, before
So
you get
omega
pregnant.
3s are really, really good for reducing risk of preterm labor, but something that gets missed or that nobody really thinks to check before they, you know, try to conceive is their iron levels. So whether you have had like really heavy periods or you had a history of eating, vegan or vegetarian, or, you have family history of anemia, getting your iron levels checked and then fixing them before you add the extra sort of, you know, responsibility of growing a human, it can make a huge difference. I tend to find that if your iron levels are low and you get pregnant, it can be really, really tricky to bring your levels up while you also have that extra draw on your nutrient stores.
Hmm.
But if we have a little bit of time to fix it before, then typically we can end up keeping things pretty steady throughout. The other thing is that, and I mean, you know this well, like as much as we can keep that sort of like birth to like transition into the fourth trimester as like intervention free as possible, it's going to be really good for mom's mental health, right? So if your iron levels are very low and you have, a significant amount of blood loss during birth and you end up needing, blood transfusion, and maybe you're like whisked away, or maybe you're like not fully there because you had so much blood loss. Like those are all things that are going to have to be worked out postpartum, right? Or
Hmm.
maybe that make you feel, you know, not as positive about your birth story because it didn't go the way that you wanted it to go. So those things to me are things that if we can put a little bit of work in, at the beginning, that we could potentially help reduce, you know, those experiences from happening for people.
Right. Um, let's talk about postpartum real quick, because I mean, it's kind of like you're not told any information getting pregnant. So a lot of people are going into pregnancy depleted. Like what I think the statistics like 95% of women take a prenatal and 97% are depleted are nutrient depleted in some area. Um, so I mean, that's almost everybody. That's pretty much everyone. So what, I mean, if we're going in depleted, I think that because pregnancy and births happen all the time, every day, and have been going on since the beginning of time, it's like, oh, you're pregnant, whatever. Oh, you had a baby, whatever. Like, it's like, no, this is a huge demand on our bodies. Pregnancy is a huge demand. Birth is a huge demand. Postpartum is a huge demand. But women have been doing it since the dawn of time. So it's just like, whatever, it's just what you do, right? Versus like really being like, okay, what do I need? And so we're beginning depleted. And that does affect our postpartum experience, our postpartum feelings, I mean, it can affect your milk supply, it can affect your recovery, everything. So I'd love to just kind of chat about like how to set ourselves up for success, or maybe like a few things to like really focus on postpartum.
Yeah. And one of the things too is that it impacts the nutrient density of our breast milk,
Mm-hmm.
right? Like if we are depleted, we have nothing to give when it comes to producing milk that is the most nutrient dense. And people don't talk about it because there's already so many barriers to breastfeeding. We don't want to add another one, being that women feel like, well, I can't breastfeed because my diet's not perfect. And that is not at all what I'm saying. You are still going to produce like the very best food for your baby. However, we can't just deliver and then stop thinking about ourselves.
Mm-hmm.
Like oftentimes while we have baby inside of us, we have this like, you know, extra sort of motivation to supplement, to focus on our food, to do all of the things to like give our baby what it needs. And then we deliver the baby and we go into postpartum and we're eating, you know, cold toast and cold coffee and, you know, 3 bowls of cereal a day and like nothing nutrient dense at all. When during this time, our nutrient needs go up even more. They are
Mm-hmm.
higher than they were during pregnancy.
Mm-hmm.
And we just totally neglect that time period. I would say that over 90% of my clients are told that they can stop their prenatal as soon as baby is delivered.
Yeah.
But we know that nutrient needs go up even more. We
Right.
know that choline needs go up even more. We know based on your birth, you may or may not still need iron. We know that if you are not putting omega-3 fats into your body, then guess what? There is not an ample amount of omega-3 in your breast milk,
Mm-hmm.
right? Like all of these things make a difference. So, in terms of nutrition for postpartum, continuing with your prenatal vitamin is huge. Making sure you're getting enough vitamin D, making sure you're getting a little bit of extra choline. Okay. So, during pregnancy, the recommendation is about 450 milligrams of choline per day. During lactation, it goes up to 550. There is some data that shows that amounts above 900 milligrams can be even more beneficial. So, somewhere in and around there, depending on what your diet and supplement routine looks like, is probably a safe place to be. Um, Omegas, if I didn't already say that, continuing with your omega-3 supplement, very, very important. And then something that I focus on with all of my clients once they're in the third trimester is planning foods. Like
Yeah.
we are making sure that we didn't just do all of this work to throw it all out the window.
Right.
We are really focusing on nutrient dense healing foods for postpartum. And ideally getting them to a place where for the first 4 to 6 weeks, they do not have to cook at all,
Yeah.
right? Because we've done all the work so that they can just pull things from the freezer and they can have the most nutrient dense food ready to go at their fingertips without having to dirty a pot or pan.
Mm-hmm. Yeah. Yeah. I know it's so important. I did a little bit last time, not nearly enough. And this time I'm planning on prepping a ton more. I actually just got a whole separate freezer.
Good.
So I'm like, babe, well, it's been on sale at Costco and it's like hit or miss when it's there. And so I saw it on sale the other day. So I called them.
Perfect.
And I like it because it's like organized. There's drawers, so I can like label things, and then it's just
Yeah.
easy to pull out stuff out of there. Um and I know I've learned again, like just so much. Like I knew some, I'd say I probably knew more than most going into my first. And even more going into my second, because before I got pregnant with my second, like, oh no, before I got pregnant with this one, when I was 6 months postpartum after my second, that's when I really started focusing on blood sugar balance and like getting 30 grams of protein in the morning and focusing on getting to bed earlier. And I did really feel a difference. And so I kind of like carried that into this one. And again, like I've just continued to learn like so much. And again, like since we've been doing this since the dawn of time, there's this thing with postpartum that it's like, well, I have 2 other kids, so it's like you can't just like not do anything. We've lost that community. We've lost like that help that we need to really let our bodies fully recover and to soak in that newness of having a new baby. And so if you can have dinner planned already that's in the freezer, you just have to take out a frozen bag of something that's already seasoned, marinated, put together, whatever it is, whether you have to throw it in a crock pot or just heat it up, like can make it so much less stressful. Because I know you're making a million decisions a day as a mom for yourself, for your baby, if you have other kids, that the last thing you want to think about too is like, what do I have in the fridge? What am I going to make for dinner? Like sometimes you just get that decision fatigue. So I'm definitely planning on cooking a lot more in preparation, and I'm excited because it's like getting into fall. So I'm like, oh, so many soups and stews and like good things that I can just double the batch, put half in the freezer, and we're good to go.
Yeah, love it.
Yeah. And breakfast, that's the one thing too that I feel like it's hard to like think of. So pancakes, muffins, you know, whatever. The first, what was the book? The first 40 days.
40 days. Yeah.
They have a really good pancake recipe in there that I used last time. So try to freeze a bunch of those. But postpartum is hard. I mean, and everybody's situation is so different. Like some people have a ton of help postpartum. Some people don't. And I know that you're in Canada, so you guys have way better maternity care than we do. So postpartum, I mean, I know people that have to go back to work very soon after having a baby. And so that recovery is rushed. You know, you go to your 6-week checkup, they're like, oh, you can have sex and you can go back to work. And you're like, cool. You know?
Yeah, I'm still bleeding, but thank you. Yeah.
Right. And the other thing I want to say too, like I love that, because this year I learned too that your caloric and energetic needs are bigger postpartum than in previous seasons. And that's where the bounce back culture has like done so much damage. And I had someone reach out to me the other day who's 6 months in breastfeeding and just being like, I'm just really frustrated. I've had such like a hard time dropping the weight this time. And I'm like, that's like not the concern right now. And I know that's so hard. Like, I know you want to drop your baby weight, but like now is not the time to focus on that. But it's hard when we live in this culture where even on Instagram, they're like, this is my 8-week postpartum body, and they have abs, and you're like, well, they're effort. Like, you know, and it can be really, really hard to not compare your situation, but our bodies are all different. Like mine my weight never melted off after, but I've like breastfed my kids forever. So, you know.
Yeah. And everybody's so different, and you're not sleeping, and your stress hormone levels are through the roof, and your body is like in constant fight or flight mode, right? So there's all of these other pieces that, you know, interfere with that, you know, ability for our body to feel comfortable enough to release weight. Because what we have to remember is that when we are in this fight or flight mode, our body has no idea that we just had a baby, right?
Yeah.
It's like, you are stressed, and we need to make sure that if there is a famine coming, that you have adequate reserves, right? So there's all of these pieces that don't get talked about, right? The only focus is, you know, you've had this baby, now you need to get your body back.
Right.
Which is just like one more burden for mom to carry.
Right. Yeah. Before we wrap up, I'd also like to talk about, so I'm due in November, like Thanksgiving week, and I'm a little bit nervous because I don't love the thought of like having a baby going into like cold and flu season and, you know, just like virus season. And you're saying like that level for vitamin D goes up postpartum. So like, I'm probably not going to be in the sun a ton.
Yeah.
You know,
Yeah.
Whereas like the summer, you know, if you have a baby in the summer, it's like so much easier just to even like go sit in your backyard versus living outside Chicago and it's 20 degrees. So,
right.
We had like 1 month here where like the sun came out twice. So, like is like seasonal things something to take into consideration when you're postpartum having your babies?
Yeah, especially for vitamin D. And it's actually really funny that you bring this up because I was talking to a client about this yesterday because I was saying that even though it's cold and flu season, I tend to find, and this is like purely anecdotal, but I do tend to find that my moms who deliver in that like winter, early spring time tend to do really well from a mental health perspective because we're naturally, especially if we're in that sort of like northern US or Canada climate, we're in this like hibernation mode already,
Yeah.
right? So we give ourselves permission to rest.
Yeah.
Or, maybe if you have other kids at home, maybe they're like allowed to watch a movie in the middle of the day because it is a snowstorm outside. So we are moving a little bit more slowly, which I think is really great for recovery. Whereas I find, especially when you only have a couple of months of nice weather, that there's that pressure to be like, we should get out for a walk and we should like soak up all of the good weather because it's going to turn. So I tend to find my moms are like go, go, go a little bit more when they have their babies in the summer versus like that sort of like hibernation mode. But from a health perspective, I would say like making sure that your vitamin D levels are good is definitely going to be helpful for, your immune health. Making sure that you're drinking lots of water, making sure that you are getting as much rest as you possibly can be really helpful too. If you are feeling well, moving your body in a way that feels good can also be, really good for your overall health and immune system. So there's all of these little pieces that can definitely play a role, whether or not like adding in a little extra zinc can be helpful or, like I really like the needed immune support supplement, incorporating that on a regular basis, especially if you have kids at home who maybe are going to take care and like bringing lots of germs in, that can be, a really helpful kind of tool in your toolkit. So there's lots of options, but I would say like at this very basic level, vitamin D, sleep, and hydration are probably the three biggest pieces that you can focus on to like really support your immune system postpartum, especially if you're
Yeah.
you go into cold and flu season with a new baby.
Yeah. Well, and that sleep one can be like, for me, it's like, yeah, I know sleep's important, but like, have you had a newborn before?
And
Like,
two other kids, Liz.
and two other kids, and two toddlers.
Yeah.
But I do agree. I mean, I would say I'm not like super strict with stuff. Like when it comes to going into Christmas season, we're going to be watching Christmas movies all day long. Like, I don't care. So I'm not worried about that, but I do think trying to get a nap in on the couch or, whatever it is, being a little bit more laxed, I think is fine. You do learn that you can do a lot on a little, but it doesn't mean that you should if you have the option not to. And I think where a lot of moms struggle is actually going to bed because it's the end of the day and you're like, I have an hour to myself. I have an hour to clean up. I have an hour to, like whatever it is. I have time to connect with my partner. I have, like I said, whatever it is, this work project that I haven't been able to get to. So I think that can like be the struggle of just being like, okay, for me, I always strive to be in bed before 10 p.m. This last month, it hasn't gone as great, but for the most part, I was doing really, really well with that. But it has made me be like, okay, like if everything's not done at 10, then that's okay. Like it's going to be there tomorrow. And I feel like trying to take that mindset into postpartum of, it's not relaxing for your mind to like sit and scroll on Instagram or whatever it is. That's not, I think if you want to watch a TV show and cuddle with your partner, that's different. But if you're just staying up late, scrolling mindlessly on your phone, that's, not a way to unwind. And I know it can be hard to stop. But one thing I thought would be super interesting to like do a study on, because babies at the beginning do not produce their own melatonin, and they've shown that blue lights affect our melatonin production. So if I'm on my phone super late and my melatonin production is being affected, is that affecting the babies because they're getting it through my breast milk?
Right. That's a good point.
Nobody's ever talked about that I've found. So I'm like, I wonder if you have a baby that's not sleeping great, maybe they're not getting the melatonin that they need from you, because you're, on your phone or whatever. But
Yeah, that's a good point.
yeah, well, one thing I did last postpartum that I did differently that first time you have sleep deprivation, like I had a little nursing station set up. I had like an iPad and I would just like watch Friends in the middle of the night. This time I didn't. And this last time I didn't. And I loved it. Like I wouldn't even look at a clock. And that's like my plan this time again, is like the baby gets up, I grab them, I nurse them. I don't look at a light. I don't look at a clock. I don't anything. I just recently got into Sudoku.
Yeah.
I'm like, maybe I'll just have a little salt lamp and like a Sudoku book or something. But not getting on any lights at all, like just really helped me be able to like nurse and go back to sleep.
Awesome.
Versus like, then you're nursing even longer because you're scrolling or whatever it is. So
I love that. That's such a good idea.
yeah, but the sleep, it can be hard. It can be like triggering, hearing people be like, you need rest. And you're like, I'm trying. My kids don't want to sleep. Like, how am I supposed to get sleep if they're not sleeping? Trust me, I want to.
I tell people that rest like can look a lot of different ways too, right? Like you don't necessarily have to be sleeping. If you can like let the dishes pile up, if
Yeah.
you can like let the laundry go, and you can instead just lay down and give yourself permission to rest, even if you can't fall asleep, is still very restorative.
Mm-hmm. Oh, I was talking to you in California about reading books, right?
Yeah.
Okay. Yeah. So we were talking about that because I'm like, it's so easy when I'm nursing to just grab your phone and start scrolling versus you'll have to send me some recommendations. Like,
Yeah.
I want to get a couple book stations because you end up nursing in different places. But instead of grabbing for your phone, grabbing a book, reading something fun, like, and then you're modeling that behavior for your kids versus like being in front of a screen. And then you wonder why they want to be in front of screens all the time, So I'm like, ever since I talked to you, I'm like, I need like a couple of books postpartum because I always read for education, not really for fun anymore.
Oh, Liz, I'll text you some of my favorites.
Yeah, do, because I'm like, I would love to just get into a good book and have that be what I reach for versus something else. So, and that can be restful too. And will probably put me to sleep.
Yeah. I love it. So many like different positive pieces to reading. Love it.
Yes. And before we wrap up, so tell us a little bit more about you. I know that you have a free prenatal meal plan and that you have so many resources for those listening. So I'd love for you to share them with us.
Yeah. So we do have a prenatal meal plan that is linked up on my Instagram account. My account handle is prenatal.dietitian. I also have some other things there. I have like a meal train ebook that is full of like nourishing recipes for postpartum that you can download and then send to your friends and family and assign different recipes to them so that they can prep really nutrient dense meals to bring to you postpartum. I have an ebook that is all about different nutrients that are very important during pregnancy. These items are like $15. Okay. So like very, very accessible. And then I have a course that you can take that is, all of these little bite-sized pieces of prenatal nutrition broken down by topic. So you can scroll through and pick the topics that are applicable to you in the stage that you're in, or you can do it all start to finish. It has recipes in there as well. So all very actionable items. And then I do take on a small number of clients one-on-one and work with them directly on their nutrition as well. But my Instagram account has tons of free information. So if you are looking to, just access some, information on prenatal nutrition that maybe you're not getting anywhere else, then I definitely recommend, taking a scroll through and seeing what you can learn.
Yeah, that's great. And I think too, it can be hard when you're like, I already have a couple of kids or whatever, but like me, I feel like I'm just continually learning and I want to feel like my best if I can. And that goes into pregnancy, that goes into the postpartum. And that's also been my mindset, like this pregnancy, as far as like I've strength trained more this pregnancy than past ones. And it's like, I have 2 toddlers. Like I need to be strong. Like I feel heavy and not super strong right now. But like doing those workouts, I'm like, man, like I just want to feel strong. Like I'm not worried about the weight gain. It's just like I have toddlers to pick up and I need muscle memory to like help me recover. But that's the same with like having nutrient stores. I mean, can you have nutrient stores? Can you like,
yes.
okay.
Yeah.
I'm like, wait, before I say this, just have things built up so that you are feeling good. And then you have the resources to like continue to nourish yourself. Because it's really easy to feel not great in this season of life. So setting yourself up for success is great. And I love that you have that meal train that you can send recipes to people, because that's like the hardest part, is when people want to cook a meal for you. And it's like,
Yeah,
you're so grateful that they do.
yeah. I tell
like,
people like send this to them and say, pick something off of here.
Yeah. Right. That's so good. Yeah.
Not another lasagna. Thank you.
Right. Which like, again, like I said, like we're grateful for, but it's, yeah, you just want to make sure that you're also like targeting super like certain foods and getting in certain things and not just living on like pasta and meat sauce your whole postpartum. So that's good. I'll have to take a look at that. But I just want to thank you so much for coming on. It was so great chatting with you. I feel like I continue to learn from like each person that I talk to, like so much. And we could go down a million different pathways, but yeah, I just want to thank you so much for your time and energy. Oh yeah, before we wrap up, since the podcast is morning Hava, how do you take your morning Java?
Ooh, cream.
Just black with cream?
Yep. Nothing else. Can't do like no sugar, no flavored anything, just full fat cream.
At home?
Yep. Always.
Yeah. Okay. Well, some people like there's certain ones out. Well, awesome. Well, thank you again so much for coming on and sharing your time, energy, and expertise with us.
Oh, thank you for having me.